All right, welcome, welcome, welcome. I believe we are live, and I see some hello, so you guys can see me. Can you hear me? All right, we are good to go. So welcome to our closing session, and since we've already been waiting, I'm going to pass it right back on to Nick so he can introduce his team to finish up with our collaborative session. And thank you all again for being so flexible today.
Thanks so much, Kenya. With that, I am going to go ahead and pass it over to Kayla Weckendorf-Tomka to talk about some of the work that CFP and NACHO have been doing on retail program standards networks.
Thanks, Nick. Hi, everyone. Thanks for sticking with us through the technical difficulties this afternoon. I'm going to talk to you a little bit about a research project that we did surrounding networks. If you can go ahead and go to the next slide, that'd be great. Okay, so the project objectives. So in 2021, NACHO and CFP, we collaborated to identify state and local retail food regulatory programs that were participating in state and region-wide networks. The networks were focused on working together to increase conformance with the retail program standards. The goal of the project was to explore how participation in the network helped jurisdictions achieve conformance with the program standards, and also to highlight any promising practices that could be shared with others across the United States. Next slide, please. Again. Okay, so what you're probably wondering, what is a network? So for the purpose of this project, a network was defined as 3 or more jurisdictions that met regularly, either virtually or in person, to discuss, share, and work collaboratively to increase their understanding of or conformance with the retail program standards. When thinking of how the network was led, the network could be led by local jurisdictions, led by a state regulatory body, or a FDA retail food specialist. Participation of the networks was not limited in scope, and all jurisdictions were considered regardless of their size, regardless of their geographic area or entity, and only networks consisting of more than 6 local health departments were included in this study. Next slide, please. So a little bit about the method of how we identified networks and chose networks. There were resource limitations among the identified networks when this study was conducted, largely due to COVID-19 and staffing issues. We originally identified 13 networks, but only 3 of those networks were able to participate in the study. Individual focus groups were held with network members in Iowa, in North Carolina, and also in the Pacific Northwest. We also sent the focus group sessions were 60 to 90 minutes long and were facilitated by the NACHO research evaluation team. And then we also sent a follow-up survey to the network leaders as they did not participate in the focus groups. And the purpose of that follow-up survey was to gain insight into the logistics of how the networks were set up and how the network was maintained, because the network members may not have been able to answer those types of questions. Next question, next slide, please. So what were the facilitators of retail program standards networks? The first one was really a network leader. So someone that was a network leader that championed and coordinated the network. They formed a closer relationship among other members in the network, and they also had more familiarity with the work and the resources of their peers. The leaders were viewed as experts in food safety and program standards, and they had the ability to interpret the standards and communicate information about how to achieve conformance to reduce barriers for other network members. Another facilitator identified was support. So that included grant funding awarded to local health departments that allowed network members to attend training and conferences that were focused on the program standards. Some examples included the FDA self-assessment and verification audit workshops, or the NACHO mentorship program. The network members were able to share information that they learned in those workshops among other network members that may not have had the funding or the staffing capacity to be able to attend those trainings. The last facilitator is shared attitudes and also motivation. So of the 3 focus groups that we held, 2 of the 3 networks had freely adopted the program standards. And the third network was a state-mandated conformance with some of the standards, while the network promoted the adoption of all 9 standards as part of their shared values to improve food safety. It was noted that having the program standards was helpful as a guide for improving their food safety practices, and being a part of a network drew inspiration from their peers that had already achieved conformance with several standards. Next slide, please. So some of the benefits of participating in the network. Being a part of a network allowed network members to share strategies and also templates for achieving conformance with the standards. By sharing information, time was saved, and there was also consistency identified among members on how standard conformance was approached. Additionally, local health departments with newer food safety program staff benefited from peer-to-peer sharing by learning best practices and leveraging the experience of their peers who had already achieved conformance with the standards. Also mentioned was local health departments with limited staff capacity felt it was helpful to have access to documents and resources that larger health departments had already created that focused on the standards, as well as other food safety messaging. Improvement of food safety overall was another benefit identified as being a part of a network. Network members discussed how they conducted routine inspections and different enforcement procedures to ensure practices were consistent and also aligned with the program standards during their network meetings. Members also felt that the network served as a place for members to have a single point of communication regarding compliance to state mandates and also any emerging threats to food safety. Another benefit identified was strengthening of network members' project management skills and local health department food safety programs. So that really meant that network meetings were used to discuss more than just retail program standards. They also discussed a wide range of food safety topics that provided for peer connection well beyond the program standards. An example is newly hired network members that had recently been promoted to program management learn from the more experienced network members about ways to run a food safety program, including purchasing of equipment, identifying funding opportunities, and also establishing goals and priorities. The networks provided a space for members to collaborate to inform the food safety industry regarding the standards, and also allowed for a single voice for enforcement and regulation. Lastly, strengthening communication with state and federal entities was identified as a benefit. The networks provided a space for members to share information they received from state and federal entities about new policies or upcoming updates, and promoted equity and communication throughout the network. The network provided an opportunity for locals to ask questions of state agency staff and also get feedback to other agencies regarding the food code and program standard adoption. Next slide, please. There was very few barriers that were identified in participating in a network, but there were some. They were really centered around limited staff time. So we are all short staffed, so we know that we don't have time for another meeting. Also program funding, resistance to adopting the retail program standards among late career staff who may have been hesitant to change. It's always scary to do something new. A perceived burden of achieving conformance. That might mean that some people try to meet every standard at once, as opposed to doing just one step at a time to do it in a more incremental fashion. And then also shifting of priorities due to COVID-19 or political resistance to additional regulations. Next slide, please. So what are the next steps? So what we plan to do in this upcoming year is evaluation of current networks that exist. So what we're looking at is, does participation really improve conformance with the program standards? And will creation of a network increase enrollment in the program standards among a region? We're really interested in finding out if that's true. What we plan to do is assist with the development of a new network and identify the baseline of conformance among members, and then measure their conformance over time. Next slide.
Thank you, Kayla. And with that, I will go ahead and pass it over to Steve Mandenack to take us through the end of our presentation.
Well, thank you very much, Nick. It's great to be here today, and it's great to be with so many of our retail colleagues across the country. Today, I'm going to talk a little bit about one of the projects that AFTO did as part of the Retail Collaborative, and that was really doing an in-depth survey of the state regulatory programs When we worked on the collaborative, we divided certain things. AFTO took the state programs, and CFP and NACHO primarily worked with the local programs. So let's go ahead and move into talking a little bit about what we learned during that survey. The survey had consisted of 62 interviews with state health and ag officials over about 6 months to complete. Interviews were based on a variety of things, including food code adoptions, including barriers, impacts on locals and future adoptions, program standards, enrollment and barriers, auditors, also for self-assessments, risk factor studies and challenges with risk factor studies, risk-based inspections, and asked a few questions about COVID-19 along with emerging issues. So when we think a little bit about that, the first question that we really focused on, and we'll give you some examples of the infographics that have been produced as part of this on our next slide. And there you go, gives you one example of what these look like. And through this process, we worked with researchers at Iowa State University to produce a variety of infographics related to the data and make them a little more accessible. Well, let's move on and talk about the first one, which is what food code are folks operating under. So the interesting thing that from my perspective that we learned was less than, and so we'll move to the next slide, Nick, sorry. The interesting thing that we learned from this was that, we ended up with approximately 60% of the states on 2013 or newer food codes. So that was very good. We didn't expect it to be that good, but that's a very good start. The other thing is 2% on older than 1999. So almost all of the states were on 60% were newer, and almost all were newer than 1999. Let's move on and talk a little bit about what that impact adoption meant. So with 93% of the states, when they adopt a food code, it does apply to local agencies as well. Of the 26 states that allow some sort of variation at the local level, 45% of them allow a local agency, the state code may, or state statute may allow local agencies to adopt their own local ordinance. And 92% of those 26 allow the local agency to be more stringent than the requirements of the state. So if the state allowed local adoption, often they could be more restrictive than the state was. We look at what the barriers were to adoption, which is the next slide. We talk a little bit about things that you would expect. Lack of staff or staff experience was the most common thing cited. Nearly, we're looking at 28 reciting that. Length and complex, time-consuming process was another common thing. Time was also mentioned by others as something that was complex, along with, of course, the legislative process, resistance, and timing. Well, a few things that we heard that we hadn't necessarily expected in this was that a lot of the barrier was just simply not understanding the adoption process for their state at the state agency or level. So essentially the food program management at the state simply didn't understand how their food code was adopted and had not been through that process. That might be a symptom of a lot of changing in staff. As we all know, there's lots of new staff in these programs right now. And that might have been one of those challenges. Another thing that we heard was that we learned throughout this was many of the agencies also struggled with understanding the impact of an adoption. So some of those questions we talked about in the last slide, it was a challenge for some to go back and review their statute and the statutory authority and determine what was their current state system. So it was kind of an interesting discussion. When we get over to program standards, we learned a handful of things also. So the good news is 54% were enrolled, 12.9% were not. But the more interesting thing was of those 33 or 61% had a self-assessment that was current. Though I'm going to put a caveat in that. Each agency was allowed to define what current meant. And there were differences of opinion in that. So I think that was one of the things that as we go forward, we're likely to be more clear on that, but we weren't initially. So for example, if a voluntary, and then so there were very interesting discussions during that process. The other thing is, it was also interesting that when we talked to those enrolled, that many of them weren't particularly clear on what the requirements for self-assessment and verification audits were. So that was kind of interesting at least the leadership level of these programs, who typically answered the survey or participated in the interview. They didn't necessarily always understand that piece. Let's talk a little bit about what people perceived as barriers to enrolling in the program standards for those that weren't enrolled, or that were enrolled, sorry. Staff and staff turnover were a common barrier. Time, of course, other priorities, COVID-19, of course, during this period of time when these interviews occurred, that was a very common item. So, I think there's another interesting thing that we tended to hear is, of course, we heard very good things about the retail flexible funding model as support of the standards and the previous system supporting the standards. We also say that they also said that 6 months is reasonable, but many to get a voluntary to get their self-assessment verified, the verification audit completed. But they acknowledged that oftentimes they didn't meet the 6-month deadline, which was pretty interesting. They also said it was very important to have a dedicated person or program standards coordinator, really was what they were identifying as key to having success. They did mention program standards networks as something that they thought would be valuable. And they also talked a little bit about some other features that they might thought would be interesting. When we move into program standards audits, we did hear a couple standard things. Most of them did say it was reasonable to find an auditor or someone to complete your audit within 6 months. Though, like I said, they acknowledged that often they didn't make the 6 months, which was interesting. 72% said they would be open to an auditor that was provided by FDA. The top 3 barriers to conducting audits: time, finding an auditor, and staffing. So it all makes sense, kind of consistent themes throughout. They also did note that staffing turnover was a big issue, in that if you didn't have the person that completed the self-assessment still available, sometimes doing the verification audit became difficult. Let's go ahead and move to the next slide, which talks a little bit about risk factor studies. So studies had been done, but often few interventions had actually been successfully implemented. So the most common sorts of interventions we heard were posters and videos, but it was very hard to determine the effectiveness. Behavior change from these type interventions was really unknown. As at the time of the interviews, 38% of those that had a risk factor study were out of date for the risk factor study. And a majority of studies will be due in 2022-23. Nearly 38% of the jurisdictions that had completed one were due for a new one during that period of time. They also did find the risk factor study toolkit to be helpful and acknowledge that Food Shield had been a good tool, and that the data collection and report development had been helpful also. Let's move on into risk-based inspections. So one of the things that we learned in risk-based inspections was everyone defines risk-based inspections a little differently. And so I think in the future, what you're likely to see is us talk a little bit more about the key qualities of risk-based inspections and what people are doing in that area. So I also think part of that is no one may want to acknowledge when asked a general question that they don't do risk-based inspections. Of course, they did acknowledge that standards 3, 4, and 6 should be in place to support risk-based inspections. We did have some examples of behavior changing interventions, but mostly they were more, we'll just say, less active interventions. And a majority do require long on-site correction. Long-term tools mainly use some version of enforcement, such as maybe civil penalties or fines, for example. Let's move on to emerging food safety issues. The things that, of course, that we heard often is no shock to anyone here. CBD and hemp, home operations, reduced oxygen, sous vide was very common, along with the general other category, which was a hodgepodge of issues that didn't have more than one response. We also, again, heard about cottage food, which really could relate directly to those home operations. Seaweed and microgreens and sushi all came up separately in that number, which was kind of interesting. So, heard about lots of different things that were out there. Of course, no surprise on any of these as issues that they did see as areas of interest. With that, that really kind of summarizes what the findings from the state survey. We'll be going out with another survey this in about 4 months. And when we do that, we're actually going to take all those lessons we learned on how to construct better questions and get better information to really do a great update of this information and learn more about what the progress has been in the last since we did this survey almost 3 years ago. So thank you, Nick.
Thank you so much, Steve. And yeah, that concludes our presentation on the collaborative. I do have the collaborative webpage there. I know Laura shared that in our first session. My email is also here if you have any specific questions. Even if they're not nature related, I can kind of point you in the right direction for folks that can get back to you and respond. But otherwise, I will hand over to Kenya so we can get our closing remarks.
Thank you so much, Nick, and our collaborative partners there. Like I say, very good information. So thank you all once again for the presentation. And I won't keep you guys too much longer because we're already past our time. But I wanted to once again just thank you all for attending our conference, our seminar today. We have more great things in store for you for the rest of the week. Tomorrow, as Andre mentioned earlier in the opening remarks, is our breakout day. So these breakouts are set up kind of geographically like they used to be, but that doesn't mean you have to attend the geographical breakout for your state or wherever you're located at. So take a look at the agendas, as Andre said, see which sessions or which presentations interest you, and please join those when the time comes and when it's appropriate for you to join. Each breakout page has agendas with session times up. So once again, take a look at that and explore and see what interests you so that you can plan your day. We'll then reconvene here on Wednesday in general session. You'll have Christine moderating for you that day. So we hope you'll come back and join us then. We got a lot more things lined up for you. Log in a little early. Be sure to explore our FDA Teams page to learn more about our National Retail Food Team. That's one of those options up at the top of your screen. Continue to engage in those chat boards and message boards, and I've seen some of you send inbox messages, so thank you for that, and continue to reach out to your peers. And we also will be sending out, there will be a survey. If you take a look at the end of each session, if you go back in to click on the session, like you were going to go into the session, scroll down on that page, you should see a link to a survey as well. Once again, thank you all for attending. And if there's nothing else, and now we will see you all tomorrow. Have a great evening.